Thank you for placing your trust in us and allowing us to take care of you during this special time in your pregnancy. We have the same desires for your pregnancy as you do: a healthy mom, a healthy baby, and for the special experience that you hope to have during this pregnancy. In this video, we hope to introduce you to the practice and to help answer some of the questions that you may have. Greenville OBGYN was founded in 1962 by Dr. Ed Clement. He was joined the next year by Dr. Bob Dayton. Together, they built the first obstetrics and gynecology practice in eastern North Carolina and began the tradition of providing state-of-the-art obstetric medical care in Greenville. All of the physicians in our practice were trained at some of the leading medical schools in the United States and are board certified or board eligible by the American Board of Obstetrics and Gynecology. Our physicians are all on the faculty of the Brody School of Medicine within the Department of Obstetrics and Gynecology and are comfortable providing high-risk obstetrical care. Our patients have the security knowing that the full resources of Pitt County Memorial Hospital, including its state-of-the-art neonatal intensive care unit, are available to them if needed. The staff of Greenville OBGYN includes certified nurse midwives. Certified nurse midwives provide routine obstetric care and work very closely with the physicians in the practice. If your pregnancy does not have medical complications, you have the opportunity to choose care provided primarily by physicians or midwives. Our midwives work as a team with our physicians and are always available for consultation or to assume care if the need arises. During your prenatal care, the nurse midwives have more time for counseling and education. Then, during your labor process, your midwife will try to stay with you and guide you in different comfort techniques in the delivery of your baby. In this video, we hope to address many of the questions and issues important to your prenatal care. However, we cannot include everything, so we encourage you to bring any and all issues to our attention throughout your pregnancy, including any illnesses such as colds and infections that you may develop while pregnant. We have several phone nurses who can answer many of the questions that you may have. You will be given an OB emergency card during your initial visit. This card provides numbers and instructions for contacting us after hours. The reverse side of this card provides a list of approved over-the-counter medications. Before you take any medication for a cough, cold, or headache, please review the list that we have provided for you. Pregnancy is a time of change. It is a time of transition between what life was like before your pregnancy and what life will be like with this baby. For approximately 40 weeks, your baby will depend on you for all the things that it needs to grow and thrive. Although it's natural to worry about your baby, try to remember that the vast majority of babies are born healthy. During prenatal visits, you will learn what is going on in your body. Please ask your doctor or nurse midwife for advice on coping with the normal changes that you experience during your pregnancy. Your doctor or midwife will also gather information for you so that you can make healthy choices for you and your baby. We want you to take an active role in your pregnancy to give your baby the best chance to start life as healthy as possible. If you are having a test done, it is your right to ask the reason and to know the risks and benefits. Our doctors, nurse midwives, and other staff members can help answer any of the questions you may have. As a patient of Greenville OBGYN, one of your first visits will include an OB workup. This may be the longest visit that you have, but it's one of the most important. We need to be aware of any medical conditions such as hypertension, diabetes, or asthma that you may currently have or have had in the past. We also need to know about medications you take and genetic diseases that may run in your family or the father's family. We will also ask about complications from prior pregnancies, including premature labor, gestational diabetes, preeclampsia, or any gynecological surgery, including cesarean sections, that you may have had. We will perform a complete physical exam that includes a thyroid, breast, heart, lung, and pelvic exam to screen for any diseases that may affect your pregnancy. We will also draw several blood tests for the same reason. In particular, we will screen you for infections, check your blood type and antibody screen, and evaluate you for undiagnosed urinary tract infection. On subsequent visits, your blood pressure and weight will be checked. and your urine will be tested for protein. We will also listen to the baby's heart rate after 12 weeks, and after 20 weeks, we'll measure the top of your uterus to estimate fetal size. During the first 2/3 of the pregnancy, we will see you about every 4 weeks. Beginning at 28 weeks, we will see you every other week, and at approximately 36 weeks, we will see you weekly. Over the years, we have found that most patients have similar questions or concerns about their pregnancy, including misconceptions about what you should or should not do during your pregnancy. The first common question is how much weight you should gain in your pregnancy. This depends on your weight before you are pregnant. Most women of normal weight are advised to gain 25 to 35 pounds. Underweight women should gain a little bit more, and overweight women a little less. If you are carrying twins, your weight gain will be even greater. Ask your doctor or nurse midwife about the right amount of pregnancy weight gain for you. Usually, women gain 3 to 5 pounds in their first trimester, and 1 to 1.5 pounds per week throughout the second and third trimesters. While pregnancy is not the time to worry about putting on weight, it is also not an excuse to eat too much. Most women need between 1,800 and 2,200 calories per day when they are not pregnant. Pregnant women only need 300 additional calories per day, so a glass of milk and a half a sandwich should do it. One guideline to remember is eating for 2 is not eating twice as much. A key to good health for you and your baby is a well-balanced diet. During pregnancy, in addition to more calories, you also need additional iron, folic, and calcium to preserve your bones and to strengthen your baby's bones. You should try to get 1,200 milligrams of calcium daily. Folic acid is best started prior to pregnancy and should be continued throughout pregnancy. There are many readily available prenatal vitamins, and we will help you choose one that will work well for you. It is important to start the prenatal vitamin as early as you can in your pregnancy, preferably before you conceive. Another common question concerns gardening and cats. Gardening and cats are sometimes associated with the parasitic disease called toxoplasmosis. This can also be caused by eating raw or undercooked meat or unwashed vegetables. The most common way that this infection occurs in the United States is by working in the garden where a cat has defecated or by changing a cat's litter box. The best way to protect against this exposure is to wear waterproof gloves or to avoid gardening in areas where there are animal feces. Make sure that you wash your hands with soap and water after touching soil where cats have been or making contact with uncooked meat. It is wise to avoid contact with your cat's litter box, but in general, you can keep your cat. Another concern centers around eating fish. Fish and shellfish are an important part of a healthy diet since they contain high-quality protein and other essential nutrients, are low in saturated fats, and contain omega-3 fatty acids. A well-balanced diet that includes a variety of fish and shellfish can contribute to heart health and children's proper growth and development. So women and young children should include fish and shellfish in their diet due to their many nutritional benefits. However, nearly all fish and shellfish contain traces of mercury, some with levels high enough to harm an unborn baby's developing nervous system. It is recommended that pregnant women, nursing mothers, and young children avoid some types of fish or eat those that are lower in mercury. Fish to be avoided because of high levels of mercury include shark, swordfish, king mackerel, and tilefish. Eat up to 12 ounces or 2 average meals of other fish and shellfish per week. Fish that are lower in mercury, such as shrimp, salmon, canned light tuna, pollock, and catfish, may be eaten in moderation, that is, once or twice a week. In addition, you should check your local advisories regarding the safety of fish caught by family and friends in local lakes, rivers, and coastal areas. Another common question is regarding deli meat. Fresh deli meat should be heated to prevent harmful bacteria. However, prepackaged deli meat bought in your local grocery store are considered generally safe. Another commonly asked question centers around travel. In general, travel is safe in pregnancy, but a few precautions are suggested, including not traveling too far after 34 weeks gestation. While traveling, you should also walk around and stretch your legs at least every 2 hours to decrease the risk of blood clots in your legs. These blood clots are more apt to form during pregnancy than any other time in your life. We also strongly recommend the use of seatbelts throughout your pregnancy. Please discuss any individual travel concerns with us as they arise. Exercise is encouraged in pregnancy. In fact, athletes have been shown to have healthier babies and also do better in labor. However, if you are not accustomed to exercise, you should avoid starting an aggressive program during your pregnancy. On the other hand, most aerobic exercises can and should be continued throughout pregnancy, although some patients, particularly those at increased risk for preterm birth or having preterm labor, may be placed on limited activities. There are several aerobic exercise programs designed for pregnancy. These are available either on book, video, and at local gyms. Again, please feel free to ask us any questions that may arise. During your pregnancy, there are several tests that we will offer you that will specifically evaluate the health of you and your baby. One of the optional screenings you will be offered is called First Trimester Nuchal Thickness and Analyte Screening. This test uses an ultrasound measurement of the fetal neck and blood levels of 2 analytes, usually done between 12 and 13 weeks gestation, which combined with your age will give a probability of your child having one of these disorders. If a 5% rate of amniocentesis is accepted, this will identify 82 to 85% of children with Down syndrome. We will refer you to ECU's Maternal Fetal Medicine department for this test. We also offer a pentascreen. This is an optional test done on a mother, typically between 15 and 17 weeks gestation, to estimate your risk of having a child with Down syndrome or a neural tube defect such as spina bifida. We are able to provide this test in our office without further referral. If you are shown to have an increased level of risk, you may choose to have an amniocentesis to confirm whether or not your child has Down syndrome. The amniocentesis does incur a small risk of between 1 in 200 and 1 in 250 of complications, including the loss of your pregnancy. If your child is found to have Down syndrome, there is nothing that can be done to change that. Down syndrome is a genetic trait, much like the baby's sex, and tests simply provide an opportunity for you to identify whether or not your child has one of these traits prior to delivery. As you may be aware, you may choose to abort a child with Down syndrome. Whether you would consider this option depends on your view of handicapped children and abortion. You should know that while Greenville OB/GYN offers these tests, we do not offer abortion services. You may choose to not do the pentascreen or the amniocentesis if you feel that you would not terminate the pregnancy. All patients are offered an HIV screen because of its profound implications for your pregnancy. We also offer optional screening for cystic fibrosis in Caucasian patients. Cystic fibrosis is an inherited disease carried by about 1 in 30 Caucasians. Cystic fibrosis predominantly affects the lungs, which results in much greater incidence of pneumonia and typically a shorter lifespan. Another test that we typically conduct is an ultrasound. This may be done at various times during pregnancy to establish your due date or evaluate concerns for fetal growth and well-being in pregnancies complicated by diseases such as diabetes and hypertension. All of our patients are offered an ultrasound at about 18 weeks gestation. An ultrasound is performed by our ultrasound technician and then by one of our physicians. We will perform a detailed review of your baby's anatomy, and as long as your child cooperates, we should be able to tell if it's a boy or girl. We can typically identify 50 to 60% of birth defects depending on the position of the baby and the characteristics such as your weight. All patients will be screened for gestational diabetes at 28 weeks. Then at 36 weeks, we will screen for bacteria called Group B strep. We will discuss these and other tests with you in much greater detail if they are positive. An optional ultrasound may also be performed around 27 to 30 weeks. This ultrasound provides 3-dimensional views of your child. This test is not covered by most insurances. However, some patients desire this test to better see and bond with their unborn child. Smoking is strongly discouraged during pregnancy. If you currently smoke, now is the time to stop for the health of you and your baby. There has not been a safe amount of alcohol established. Therefore, we recommend no alcohol consumption during pregnancy. Intercourse is safe throughout pregnancy unless you are otherwise instructed by your provider. Flu vaccines are recommended for all pregnant women regardless of trimester. Be sure to protect yourself from the flu, especially during pregnancy. Other vaccinations may be given in various trimesters of pregnancy. If it's your time for your routine vaccination, speak with your provider about the best time to get vaccinated. Another frequently asked question centers around the finances of your care. Very early in your pregnancy, you will meet with a financial counselor who will review your medical insurance and estimate what portion of your fees will be paid by your insurance and which are your responsibility. Your obstetrical package includes routine visits to our office during your pregnancy, labor and delivery process, and a follow-up postpartum visit. Ultrasounds, laboratory tests, extra office visits, or admissions for complications of pregnancy, such as preterm labor, are billed separately. We ask you to pay your estimated responsibility by 32 weeks, approximately 2 months prior to your due date. Preterm labor precautions will be included routinely during your visits beginning 20 to 24 weeks gestation. Signs and symptoms include painful menstrual cramps, dull low back pain, suprapubic pain or pressure, pelvic pressure or heaviness, change in the amount of vaginal discharge, diarrhea, contractions perceived more often than every 10 minutes, not relieved by lying down, and premature rupture of membranes. A lot of these symptoms can be normal discomforts of pregnancy. Discuss them with your provider if you have questions or concerns. It is important to start monitoring your baby's movement during your last trimester. There are several guidelines for assessing fetal movement. A general rule of thumb is twice a day ensure your baby moves 4 times an hour. Babies are typically more active after meals. If you notice a decrease in movement, call your provider. We offer several childbirth preparation classes. Baby care, breastfeeding, and childbirth education are just a few. Please ask our receptionist for dates and times of these classes. You may also check our website, www.greenvilleob.com, for a monthly schedule. We hope that you will include the father of the baby or any other support person when you attend these classes. These classes fill quickly. Now is the time to have your name added to the list. We also carry a variety of prenatal cradles at our office. As your body changes, you may find that added support for your back and abdominal areas is desired. Prenatal cradles, or maternity belts, provide this support so your muscles don't tire as easily. Our nursing staff can assist you in proper fitting. In addition, we sell Medela breast pumps. We are competitively priced, so check out our selection before visiting your local retail store. Labor and pain management. Be thinking of your pain management preferences during labor, either by reading articles on the topic or attending childbirth education classes. Questions should be brought to your provider, who will gladly discuss this further. As you approach the end of your pregnancy, we will discuss signs of labor with you. In general, signs of labor are spontaneous rupture of membranes, your water breaking, which may or may not include regular contractions that are getting progressively stronger. We will discuss these in more detail during your prenatal visits. Again, it is important to monitor your baby's movement during the last trimester. Remember, a general rule of thumb is twice a day ensure your baby moves 4 times an hour. Babies are typically more active after meals. If you notice a decrease in movement, call your provider. Prior to delivery, we will provide you with a list of area pediatricians. It is important to choose one prior to delivery to care for your baby while in the hospital. After your delivery, we will care for you while you're in the hospital, and we'll see you in the office about 6 weeks postpartum. If you have a male child and would like him circumcised, one of our physicians will do that, typically the day after delivery. Our practice also employs the counseling services of Allison Broder, a licensed marriage and family therapist, who can assist you with any emotional problems you may have. She has particular experience with postpartum depression, premenstrual syndrome, and marital conflict. Hopeful Beginnings, a support group for postpartum depression, meets at ViQuest each month and is a free service, and childcare is provided. Purchase your baby's car seat prior to delivery. Your local fire station offers free inspections for proper installation. The hospital will ensure that you have a car seat installed in your vehicle at the time of discharge. However, they cannot advise on how to properly install them. The American College of Pediatrics recommends breastfeeding for the first year of life. Our office offers breastfeeding and baby care classes, and there are lactation specialists at the hospital to assist you with breastfeeding concerns. We hope that you will make educated decisions during your pregnancy and include your family as much as possible. Pregnancy is an exciting and miraculous event in your life. It's the first step to a lifetime of the joys and responsibilities of parenthood. We hope that this video has been helpful, and again, we thank you for putting your trust in us and allowing us to care for you during such a special time in your life. Please feel free to ask any questions that you may have when you come for your prenatal visits.